to respond in brief, and then probably we can have a discussion during lunch. I just felt that I should raise a few concerns, which I think the presenters can take into account when they're answering the question. I think this last month has been a very interesting month for many of us who have been working on these issues. The SDGs have been announced, the followers of the MDGs, which we have more or less kind of remembered in the last 15 years. And these are again very, very important. I mean, somewhere one of the big criticism that came up with the MDGs is that they broke down the entire development experience, I mean, the whole development process into targets. So you have these 15, 16, 17. Poverty, you do this, nutrition, you do this, hunger, you do this, and that's something which is broken down. The SDGs have expanded it. Now we have 169 or something like that many indicators. And probably somebody will go a little further on that. But ultimately, the problem with MDGs is that because it shifted the entire debate into a direction where the outcomes were the ones which are more important, and we forgot about the big questions which have been dominant in the development discourse for a long period of time, and got focused into how to reduce poverty, how to remove this, and how to do that. And I think that's something which is continuing to in the development literature. And that's where the second important thing is the Angus Deaton getting the Nobel Prize. Apart from the fact, whatever he says about RCTs and their implications, which I partly agree with most of his observations, but also I'm more optimistic about the RCTs than he is, simply because what it has done is basically it has set out a team of researchers into the field to understand these questions which actually have bothered a lot many of the development people. I mean, like nutrition, poverty, these are not easy questions. And the fact that a lot many people are moving into these areas and trying to interact with participants in the villages, that itself is a huge achievement. What they're doing may be a secondary question. Whether that is valid, technically correct or not correct is maybe a different question. But the fact that it has created a kind of a revolution where people are going and asking those questions and trying to understand in good or bad ways is something which is very, very important. But I think the issue there is what Angus is raising about. The issue is about measurement, which is an important part of it, but also talking about, are we looking at the broad aggregate pictures or not, which is related to the SDGs. Are we looking at just one treatment, or we're looking at a macro pictures? Because all of the questions that we are talking about have implications which cannot simply be factored out. And I think that's where the issues come in. I mean, NREGA, for example, you can do a randomized evaluation, say whether the NREGA raises income, does it raise schooling, does it raise, women empowerment, does it raise this, does it raise nutrition, all these things can be measured. But how does NREGA raise wages, and what impact it has on others cannot be done through RCTs, because that needs a completely different kind of an understanding. And so is the case with cash, for example. Yes, cash does raise nutrition, and there is no doubt about it. And these are some of the questions on which I don't think we need to have a debate on this. But does it lead to other issues? For example, what is the link with that with inflation? If you move away from a MSP system to a cash kind of a system, does it have a system on how does it affect the aggregate prices of cereals or other commodities? Or is there an impact or not? I mean, we don't know. I mean, probably we need more studies about it. And I think that's what it was coming out, that even the cash versus food debate is not giving a concrete answer. 4-country study, Uganda is the one clear cut which is showing that cash is, but in all the others you are getting a different kind of an outcome. So it is not just treatments, it's not the individuals, but it is a lot many other things. And that's where I think we come to the Bangladesh question, where I think I must say that, I mean, Akhtar has been bold enough to present the results and at the same time come to the conclusions, which is that cash and food are equally effective. Or, for example, transfer loans are inadequate, and BCC plus cash does better than anything else. Because if I remember all the slides, I didn't have any slide where BCC plus class was put in with BCC plus food. There's not a single slide. But in all slides when there was food and cash, food was doing better. So I would say that there was a way of interpreting how are you getting the evidence out of it. But I think there were puzzling questions. Puzzling questions was that normally in a situation where North, which is a better market, one would like to have a better impact of cash because markets are doing better. I mean, like that's what market is, cash is something. You don't get that kind of a result. You get it in South. And then obviously savings, people's behavior, people are saving more because it's drought prone, because it's flood prone and all those things. But again, those are again asking about big questions. People's saving behavior is not a part of your randomized things. That's more of a conjecture, your speculation, guesswork and all those kind of things. But I think in some cases, and that's one where has to be very, very careful about it, that evidence does not give you the same kind of a thing. But we are coming to conclusions which are very, very simple kind of a question. And we ourselves have done a study on the food versus cash thing on the NSS data. And we using the NSS data, get a clear-cut evidence that in-kind transfers have double if impact on calories compared to equivalent amount of cash controlling for almost everything. Again, following from Deaton, because Deaton was one of the first persons who started working on this, and his whole entire body of work has been on heights, nutrition, health, and well-being, using lots of these data. But a question that is always there in our mind, and something which we have not been able to answer, is that it's not a question of whether cash is effective or not. Any cash is effective. I mean, this is not something which is a sitter, basically. You give more money to households, people will consume more. The question is not that. Question is, what is the elasticity of that increase in cash to food? That's the basic question. And it varies from poor people to rich people, where the elasticities are going to vary. What would have been interesting, and I think Tom or somebody else could answer this, is there an inflection point? What if you're giving 250 rupees? What I gave 25,000 rupees? What if I gave 2.5 lakh rupees? Is there a variation? How does this 250 rupees come about? Because 250 rupees is maybe 1 day of wage, or 1.5 days of wage, or something like that. Or what happens if I give only 50 rupees? Will it be, is there a range at which the results start wavering? Is it something which is changing? Because 250 rupees is the amount of transfer that a household gets in a month for the entire PDS. And it's just a one day's wage work in current wages. So I think those are issues which I think the RCTs can answer. And they can basically suggest that, okay, there is, and that's where the last point is, that when you look at the fortified salt, you are looking at some kind of a range which can inform the policymaker that this is the tipping point. Are we getting that or not? Because if you are looking at 250 rupees, I can do it with $2.5 million or something like that. I might get a different result. But that's not the answer about cash versus this. That's about the level. And I don't think we have an answer to that question. And the last point, I think it is where I was talking about, that somewhere the issues that Tom raised about this whole infrastructure, about distribution of money and the finances, is an important component of this thing. And remember, Tom had access to many people, volunteers who were whatever language, speaking English or Hindi. If they go to the bank managers listen, and you probably get your facilitation done. Imagine a poor person going and doing the negotiation with that. Are those infrastructures important or not? That again is an important question. Those facilitators, because the state governments will not have those kind of facilitators. And the upscaling issue is the important issue that we are going to talk about it. And I'm sure this whole Kirana versus PDS shop is, again, what the Kirana shops, we know it about. And you don't need, the big multinationals of fertilizers know very well how the Kirana shops can influence behavior. Because if you go to a Kirana shop and change your voucher, you can get many more items. That's much more fungible in a Kirana shop than in a PDS shop, because the items are much lower in that thing. But I think the issue that is important again, and which I think is just for fun, the RCT kind of a story. What is the difference impact of having Santosh Mathew as your supporter and not having Santosh Mathew as a supporter? Because all RCTs are dependent on those kind of things. Does the behavior, because in a village or in a district, what the bureaucrat says, and we all know this. In Delhi, we don't think about ISS sitting here or there. In the villages, those are what we call as the prashashan, with the red light and bacon and all that. Does it matter? Can we get an idea of that with him giving a command that all of you follow? Here is a guy, we do that. And he changes and somebody else says that don't follow. Does it change their behavior or not? Can we do a DID in that or not? First level, second level, or some other level of it. Because it is about political priorities, and they are as much an important part of the entire The bureaucracy in that sense is an important part of the structure of it. Tamil Nadu, the minister says, it happens, doesn't need to have any, or Chhattisgarh, Raman Singh decides that I want to have this, it happens. So the leaders who are basically facilitating these, how important are those, is a question which RCTs can answer. And they should answer. They should answer and say, what was the contribution of that, controlling for the behavior of the person involved. I think this is just a question to, which I think should be answered. But I must say that the final conclusion that comes is that issues like nutrition are really, really multidimensional, and we can design at least 1 million RCTs on washing, on sanitation, on hygiene, on food, on nutrition and vitamins and everything like that. And there can be all 100 answers to that, and we are not going to get a concrete answer to any one of these. Most of these are going to be working in conjunction with each other, not in isolation. So one RCT can only, in fact, one part of it, not the other part of it. But these are all important interventions which we must keep doing, which we must do to get an idea of how exactly do they work out in the field. And that, I think, after all, is the important lesson that we can give to the policymakers as to what are the implementation bottlenecks, either in terms of successes, failures, banking system, the Anganwadi workers. Remember, the Anganwadi workers gets around 3,000, 5,000 rupees. I mean, if you raise the salary of the Anganwadi workers, how does it impact? Is again a very good RCT. I mean, one should be doing that kind of an RCT, because you are getting, when you are giving 5,000 rupees to the beneficiaries, but the person who is doing for 500 beneficiaries is getting 3,000 rupees is completely different kind of a thing. So I think a lot of messages on this, and at the end of it, I will not go to the extent of saying that there is no utility, but I must say that people like Purnima have to bring in the all aspects of it, because I certainly am not an expert on nutrition, and none of us can be to that level, but it does raise the fundamental question. It's a complex problem, and it requires a complex, it requires a much simpler understanding of what is going on. That is what we all are trying to figure out.
Thank you for great remarks, Himanshu. Let's maybe get the questions responded to by the people on the panel, and then I'll just close up the panel after that. There were some specific questions.
Sure. Maybe if I take a first dig at the question on the value amount, and then come back to the much harder question from Manny. I mean, I think there's a reasonable body of evidence that shows that a small predictable cash transfer is more likely to be used for consumption than an infrequent, lumpy, larger cash transfer. I think there's two issues to the amount. I mean, and the amount is also linked to frequency. But the benefit of having a small predictable amount is not just that it's more likely, I think, to be used for consumption in a normal kind of cash transfer kind of thinking. It's the predictability of having money coming in every month that unlocks the potential for a cash transfer to also act as an informal insurance mechanism, and the value of cash in terms of then helping to avoid negative coping strategies. But from a conditional cash transfer perspective, I think a small frequent transfer is very important because it links very closely the time between action and reward. And if we're thinking of a cash transfer, that the value of a conditional cash transfer, you're thinking about what's the amount that you need to change people's behavior, what's the amount to flip behavior, what's the elasticity of behavioral change or demand for services with respect to a cash transfer. But that elasticity is going to be higher for a given amount if the time between action and a reward is smaller. The value we put in is very small, but it comes very quickly. I mean, the effect sizes that we showed were very high as effect sizes, but from an extremely low base to quite a low base. Whether we'd have had even more of an effect if the value had been higher, I don't know. But I think I would link the question of value and frequency. On this extremely challenging question around scaling and external validity, I mean, I can give some general thoughts on our program and some probably more waffly, more general thoughts. But I mean, I think the scaling is linked to external validity, and I think there's a tendency amongst researchers to think of external validity about if you take the same intervention and apply it to a different treatment group with different characteristics, do you receive the same effects? Now, in the kind of intervention that we've done, I would be less worried about that, because what you're saying is, can you use this cash transfer to increase the demand for services that are provided through ICDS, and level of service delivery and service uptake is pretty low across all of Bihar. But I think the much harder part of external validity is, does the intervention itself stay the same when it gets bigger? Because the systems and structures and capabilities of government to deliver at scale are extremely different from delivering a pilot. And I think that it's an extremely difficult question. I mean, you always think about this continuum from efficacy to effectiveness, and it's linked to that kind of framework. What we've tried to do with our program is, okay, on one hand we have light touch support, but on the other hand we are fully saturating service delivery areas. So in these blocks and in this district, it's every Anganwadi worker, every CDPO, every lady supervisor, the DPO. The model, if it was applied to more districts, wouldn't put any additional burden on the same functionaries that you get in different districts. Whether the overall management capacity of the state government could handle something going on in all these districts is complex, and whether if we descaled the amount of support that we gave to these government officials, whether it would still function as smoothly is a question that keeps me up at night. I mean, I would think for our program, I mean, the future of it is uncertain, and some of it will depend on whether the midline results show this has actually worked or not. I mean, you could think about, well, the next step would be to scale this to one district without any support and see if it still works. And the question is, what is convincing evidence to think that this could work at scale? But I think right from the beginning of this program, we've always asked the question: are you trying to pilot a proof of concept? In which case, you sort of make sure the intervention works and then see whether or not it has an impact, which is easier to do in a sort of RCT setting and through NGOs, etc. Or are you piloting the first stage of a policy reform process? And if you are, that's much harder, and that's what we've tried to do is think about this as the first stage of something that could be potentially scalable, and explicitly make design choices that probably have reduced impact, but probably give a fairer sense of what it would be like to operate at scale. So I think, I mean, my just more general answer to your question is, I think just being extremely clear as to what you're actually trying to do with these pieces of research. Are you testing a concept? Are you generating an answer to something that's not known, or are you starting off on a tentative policy reform process? And it's an extremely different set of issues.
Sorry. Thanks. Do you want to take the question?
Which one?
It's on.
Okay, I have two questions on I was asked two questions on BCC in Bangladesh, and then I'd like to also touch on the issue about scaling up and policy part. First, in Bangladesh, there was a question how this BCC is different from the normal BCC. Well, yeah, this BCC that was implemented for this experiment, this was really very intensive BCC, and WFP did it very well, and so this is ideal, but it was supposed to be ideal. All the BCC, not only BCC, transfers and everything was supposed to be ideal, so that we could test the impact of doing this. But now the way this BCC is maybe different from other BCCs is, I think Purnima can also shed some light on that, because she was involved in another BCC program which was done by BRAC in Bangladesh. Now this BCC, number one, every week this BCC training was held for 2 years. And the curriculum was also from time to time changed, because it was not the same message that was given for 2 years. Also, community participation was there. Every month, there's imam of the mosque, village head, school teachers, they were also given this BCC training. And actually, we have estimated this impact of that, and there is impact. You know, those villages that had BCC, they had this spillover effect also. So that worked. And about the cost of BCC, there was one question, $50 per year per beneficiary. This cost, we taken into account all the cost, including WFP's, you know, relatively higher cost of administrating. So if government does this with the same intensity, the cost probably would be lower, because WFP costs tend to be quite high than the, you know, government cost. So this $50 per year is on the higher side of cost. Now about this, the question about, you know, RCT and how this could be scaled up, and what are the policy relevance. For Bangladesh work, this was done keeping the policy in mind. So when we started this work, we involved representatives from 7 ministries, and from Ministry of Finance to Women's and Children Affairs, Ministry of Health, Education Ministry, they are all involved in a sense. You know, first we explained to them the concept, and then they visited both North and South several times to see for themselves how this work, this experiment is actually working. And so there is this sort of participation by the government agencies was, I think, very important, because this was supposed to be contributing to the social protection strategy development, and it did. You know, this recommendation is there, you know, implementing this in large safety net programs, this behavior change communication. So I think, you know, if implementing agencies, particularly the government officials, if they are involved from the design stage and then, you know, throughout the RCT, then I think, you know, there is a good possibility of adopting this as a policy also. Thank you.
Great, yeah.
Okay, so I think we have,
Did you want to make any?
No, so I was just going to answer the gentleman's question, which would just take me a minute. So, you know, in terms of looking at out-of-school adolescent girls, and if, you know, if there was any change in, you know, if they had higher anemia rate. So I didn't talk about it during the presentation, but the pilot also did go to Anganwadi centers, which is where out-of-school adolescent girls would be coming and be part of the program, and that wasn't the case. So even in Anganwadi centers, the program is working very well, and in Tamil Nadu, you know, there aren't very many out-of-school girls. There, you know, most of them are attending school, so that wasn't the case. The discrepancy, you know, it's difficult to say why, you know, the secondary data and our pilot study data, why the anemia rate was that different.
okay, I think we have come to the end of the session, and we should leave some questions for the discussion during lunch. And obviously, our afternoon will have a different discussion. But before you go for lunch, one last question for the RCTs. I think for me, the biggest cash transfer is growth. I mean, what cash transfers do is basically raise your disposable income. And that's what growth does. So when growth happens and your per capita income doubles, and we have roughly around more than 60 cash transfers currently running in this country, various forms, conditional and unconditional. But if you look at the quantification of it, the biggest cash transfer in that sense has been growth. Our per capita income has increased by 2.5 times in the last. Yes, that's the question. Does it, where is it reaching? And the elasticity of that cash transfer to various impacts. Because in quantum, that is far, far more in terms of quantity. In quantum, it is very, very high. And has that actually had an impact or not? Because that question is the age-old question that economists have asked from Adam Smith onwards. What happens to distribution and how distributions impact this, and what exactly is growth, and how does growth link to development? But that's the most standard RCT question.